Hello everyone, this is Dr. Carlo Oger, board certified emergency physician with Dr. ERTV. This is EDX Video Pro, the channel specifically designed for the healthcare enthusiast. This is me holding a scented candle that a local business produced. It's called De Oger. It's an emergency, so go subscribe to this expert's YouTube page. Apparently this is a nurse at the hospital who also has a local business where she sells stuff, and she made these candles with different scents and flavors, and I have my own flavor. How cool is that? Anyway, that was pretty cool. Alright, so we're doing a case today. We're going to discuss a 42-year-old white male status post liver transplantation who presents to the emergency department with altered mental status, headache, nausea, and fatigue for several weeks. He denied fever, chills, photophobia, and neck stiffness. His medical history is significant for autoimmune hepatitis, which of course caused the liver failure and then the need for transplantation, for which he received orthotopic liver transplant 9 years ago. His immunosuppressive regimen including mycophenolate, mofetil, tacrolimus, and prednisone. His cellulitis had not responded to 3 courses of intravenous antibiotics, and repeated wound and blood culture results were negative. So we would think it's not an infection. Imaging studies were negative for abscess, so there was no deep pus on this lesion. On presentation, patient did not have a fever. He was afebrile, had normal vital signs. Physical exam was unremarkable except for the swelling of his left ankle with a 1 × 2 centimeter crusted plaque over the medial malleolus with surrounding erythema. Don't worry, we're going to take a look at that in just a second. His neurological examination result was normal. Initial study results like blood work and CT scan computed tomography conducted in the ED were negative. Dermatology was consulted and a skin biopsy was performed. Now, this is a very important thing. Rashes are hard. They really are. And sometimes you just need to take a biopsy and look at it under microscope to really tell what's going on. Blood work, CT scans and stuff like that were negative. So there's no way to tell what something is just by looking at it sometimes. This is a rash, the medial malleolus. You can see the little eschar in the middle right there, and then the surrounding redness and erythema. So it definitely looks like infection, but yet all the cultures were negative, and swabs and things like that, the CT scan and so on. Here you can see a little bit better. It's just like a dry lesion there with a little bit of redness around it, redness going down to here. So what are we talking about? We are talking about Cryptococcus neoformans. Culture of the skin lesion showed the Cryptococcus neoformans. Brain MRI showed abnormal signals suggestive of meningitis, ventriculitis, and plexitis. Now that's pretty terrible. He had infection in his brain, ventricles, and plexus. Lumbar puncture reveals cerebrospinal fluid titers of cryptococcal antigen, confirming the diagnosis of disseminated cryptococcal infection. The patient began receiving intravenous fluconazole, and because of the high antigen titers on repeated lumbar punctures, amphotericin B and flucytosine were initiated, after which his cellulitis resolved and his mental status improved. So, even though his neurological exam was normal, even though CT scans were normal, even though his blood work was normal, patient had a serious infection that was showing up in the foot and the ankle, but was actually involving his brain. He had meningitis, he had ventriculitis and plexitis. So always maintain a high index of suspicion, especially a patient who is in multiple immunosuppressants. We show those here. He was on steroids, he was on tacrolimus and mycophenolate. So these things lead the patient to defenseless against infection, leading to this Cryptococcus neoformans. So this is a lesson to learn that Don't rely on labs alone. Kind of go further if you need to, especially if this patient is immunocompromised. And in this particular case, patient needed the MRI to make a definitive diagnosis suggestive of this findings, and ultimately correct treatment with intravenous fluconazole, as well as amphotericin B and flucytosine. So Cryptococcus neoformans is the flavor of the day. Let's soak that in. Immunocompromised patients due to liver transplant and being on steroids. And that's it for today, guys. If you enjoyed something, if you learned something today, don't forget to like, to subscribe, and please share the video with other healthcare enthusiasts like yourself so I can keep on making these videos for y'all. All right, take care, guys, and we'll see you on our next video. Bye-bye.